Hospitals are consolidating and simplifying bills as they work to improve the patient experience. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hederle with AHA Communications. The AHA is developing tools to help hospitals create a better billing experience for their patients. We will continue to highlight how hospitals are successfully doing this work and share resources designed to help hospitals implement the AHA patient billing guidelines, including issues around financial assistance and collections practices. In this Members in Action podcast, Julia Resnick, Director of Strategic Initiatives at the AHA, is speaking with Stephanie Schneider, Vice President for MedStar Georgetown Medical Center, and Susan Whitecotton, Vice President of Patient Financial Services and CBO at MedStar Health, about how the Maryland-based health system is creating a simpler billing experience for their patients. And now, over to Julia.
Thank you so much for joining me today, Stephanie and Susan. Let's start with a little background on MedStar. So, can you tell us about your hospital and your community and why there is a need to change how you bill patients?
MedStar is an integrated health delivery system in the Baltimore, Washington region. We have 10 hospitals and a large physician-employed group comprised of in excess of 3,000 providers that we bill for under two primary billing systems, one for the facility and a different physician billing system that historically we've been, over the last 10 years, spending a tremendous amount of time to consolidate that billing from a number, particularly on the professional billing side. We had a significant amount of external billing companies and disparate billing departments and systems that we utilized across MedStar that we consolidated down to those two platforms that I mentioned. But despite that, each of those billing platforms pushed out a number of different patient statements at different intervals in time that resulted in our patients receiving potentially multiple statements at different intervals during the month for what they might consider a single episode of care, like an admission spread, a hospital and the number of providers that saw that patient during that encounter. So this resulted in significant confusion on the part of our patients and dissatisfaction, quite frankly, when they would be receiving these bills. So we worked together to leverage a lot of our consolidation efforts and our singular patient identifier, our single registration that we've created, and leverage that with a vendor in order to create a single enterprise statement for our patient for their hospital and the majority of their professional billing activity.
Well, that certainly seems much more straightforward. So, can you talk a little bit about what changes you make and how they address to the issues that you had identified?
Sure. So we, instead of sending the patient liability amounts out on those individual statements that we mentioned, we worked with Loyal, a vendor, to create a single repository of all those patient liability amounts. And we work with Loyal and create at a single interval during the month a patient statement that consolidates all patient liable amounts that exist at that interval of time and produce for the patient a statement that patients can choose to opt in to electronic or paper delivery or both. And then we connected to that a number of self-servicing options for our patients, such as the ability to pay online, create their own customizable budget plan that works for the interval of payment and the tender type that they want, as well as offering to our patients an additional number of tender options that historically we were not able to offer on our individual billing platforms.
That is great. So, do you have any stories or examples that could help this come alive for our listeners? Like, what does it look like for a patient at your hospital when they receive their bills?
Yeah, I can take that one. So I think overall we've seen some positive trends and some positive feedback, although we are still somewhat in a transition phase, but we are starting again to get some positive feedback. Patients like the look and feel of the new statement. It's all in one place. It's very easy to read. It flows from the beginning to end. We had a lot of input from consumer groups to help us design that to make that very friendly. In addition, we are seeing the migration, as Stephanie mentioned, to the self-service tools. Just recently, this week, we pulled some data from the tool, and we are now starting to tilt on the self-service side, seeing up to 50% of our patient payments are coming in through those self-service mechanisms, those tools that sit within Loyal. And we expect to continue to see that tilt as time goes on. And I think the other important point to make with regards to the work we've done here with the platform is we've also done a virtual call center with customer service teams on both sides of the house, have been cross-trained and are able to service the patient with one call versus in the past they would have to talk to two different reps on each side of the house. So that has also been a positive trend. Now, there has been some challenges with that because as we go through the learning curves, they are resulting in some longer times. But again, we anticipate that that will improve day by day as people become more familiar and comfortable with handling those calls on both sides.
Yeah, and I want to pick up. You mentioned that you got input from consumer groups as you were doing this. Can you speak to a little bit to what you learned from them and how that helped you shape your approach?
We did our initial design, and I think we called that Frankenstein, didn't we?
We did.
Uh, we bounced this off of the consumer group, and Stephanie helped me out. I forget the name of them. But that went back and forth along with our marketing team as well to make sure that one, we had the branding correct, and two, that for the typical patient, it made sense to them. So we had several revisions of that over a course of time in the development of that statement.
Yep. And I think sometimes what was intuitive to us was not necessarily as meaningful or as intuitive to patients. So I think our Frankenstein mock-up got us about 80% there, but getting us, across the final goal line really took the feedback, not only of our consumer groups and the various round robin reviews that we did, but also our human factors engineering team taking a look at the statement and making some recommendations to reorient some of the objects on the statement to help train the eye towards certain key details and be more sort of crisp and open in the delivery of the statement so that it's more easily digestible.
I'm loving this vision of like the Frankenstein model and it really taking a collaborative approach to turn that into like a living, breathing, functional tool.
Yeah, and one other thing that I'd like to add is we were able to, for those patients that do not initially provide us with, say, an email address or a mobile phone that we don't already have an existing digital sort of contact relationship with. The other thing that we were able to add to the statement was a very prominent QR code on the statement, both the top and the back, so that if patients want an easy bridge from the physical statement that they would receive mailed to them to bridge into the self-service tools or to make digital payments, they simply launch off of that QR code and it takes them straight into the portal in order to initiate that process. And that has been a patient satisfier rather than having to, historically we had some pay online options, but you had to put a pretty cumbersome URL and type it into your browser, and there was nothing intuitive about the URL. And this is a much easier bridge to launch from the paper into the digital.
That's very cool. So, speaking of patient satisfiers, I'm really interested in what the impact of this work has been, both on your hospital and the experience of your patients.
Yeah, so we've gotten good feedback from the patients in terms of their ability to understand the bills and what the liabilities are, in other words, what their patient responsible amounts are, and connecting some of the activities that they're receiving. Of course, in healthcare today, there may be disparate timing in terms of when some of these bills are processed and paid by the insurance companies and when the patient liable amounts become due. So there's not always a one-to-one alignment with the, say, the facility charge and all the professional bills, but the manner in which we laid it out to sequence the items, first with the facility and then within the professional, in the order that those activities were processed by the insurance companies and when those liable amounts became due, it more easily aligned with when they were getting those communications from their insurance companies and helped them understand what they received perhaps in email or in mail from their insurance companies, and then ultimately this statement from us. I could characterize our statement. It's really much like your sort of an online banking tool. Today I use online banking and I do bill pay online, and I can see a variety of bills that are due to my electric company, my cable company, and I can launch and make payments off of that. I may see charges that are accruing on my credit card that are not yet due, but if it's a new charge that I made, I would see it on there. Likewise, if our patients are interacting with us and going directly to the digital platform after their monthly statement has been produced, they'll see if additional patient liability amounts happen to have been sent through from their insurance carrier, but they're not yet due. So they sort of have a living, breathing, real-time look at all of our patient liable responsibility amounts in our systems, which is a different view than historically they had.
And they can always access that, be able to refer back to it if they have any questions.
Absolutely. And it's given us a different view, quite frankly, because historically we didn't have this ability to see all patient liable amounts across all the hospitals and the physician groups sort of simultaneously to understand this. So we're still learning and growing from this experience as well. So it's given us quite a unique vantage point.
Absolutely, and I'm sure this has been quite a learning experience for you. So, for other hospitals that are thinking about changing up their billing approaches to make them more patient-friendly, do you have any lessons learned that you could share about like the implementation of this process?
So I can start with that one. It did require us to really synchronize all of our processes. So we really had to go back and disable many of those workflows that we have developed over the years in our individual systems and bring them together to make sure that they were synchronized and working in the same fashion. But that's actually been a positive thing as an outcome for the patients as well as for us, because as everything's being recorded on one statement now. So as an example, when we go to do a financial assistance application, everything's laid out right there versus us having to go in and look for individual accounts. So that has helped in that process. And as mentioned before, just synchronizing the timing of the statements, the length of the dunning messages so that patients are getting them, having all of that information presented to them, and then giving them the ability to do the self-service functions. And so that was a big lift, just the system itself, bringing the systems together, untangling our processes, and then building new processes that were aligned with each other. And then I think importantly, our teams really came together as partners, and that has been I think, a very good experience overall for all of us, really giving each other a breadth of knowledge that we didn't necessarily have to the extent in the past, with us focused more on hospital billing and the other side on physician billing. And so it really brought the teams together and got them to think differently, again, to align those processes and work together as a whole instead of as separate units. And then I think lastly, it also brought forth, we had to develop new muscle because we had to now we need to manage, external databases that pull data from multiple live billing environments. So there's a lot of files going back and forth and a lot of reconciliations, which, we are automating a lot of that, but it's a process in development that you are learning as you go.
For our customer service agents, this was a welcome initiative. I think a number of them, particularly those who are long tenured at MedStar, had experienced patients really clamoring for this kind of need to call one person to talk about their bill. And historically, of course, we would have to say, no, you need to hang up the phone and you need to call this number if you have a question about your hospital bill. I can only help you with a physician bill or vice versa. And so empowering the agents to be able to really offer the support and assist our patients with their questions and with their needs has been very rewarding for a great many of our agents. So very powerful from that perspective as well.
That is fantastic. And I'm sure that this is just, some of the early steps on your journey. So what is next for MedStar in this space?
So we do have a phase 2 approach for our tool. We're continuing our development with our virtual call center being one, but as far as the tool is concerned, we're going to be expanding it out to our pre-visit area and expanding those tools for them to be able to utilize as well. And these are for our scheduled surgical patients where we will be starting. And today, that process is very traditional. Patients get scheduled, they go through the pre-visit clearance process, and then a patient estimation is determined. And then we dial the patient on the phone, again, the old traditional way. And so we run with a contact rate of about 55% on average. We hope to achieve a higher contact rate with the new tools that we can leverage so that we can get to the patients to improve our patient awareness. We found that this service has actually been well received over the years. It gives us an opportunity to educate the patients in advance of them arriving, making them aware of any other financial responsibility, answering any questions in advance of their insurance companies so that if they need to contact them.
Well, wonderful. So thank you, Susan and Stephanie, for joining me today and sharing this really important work that you're doing at MedStar. And we look forward to hearing how that continues to grow. This has truly been an excellent example of how hospitals can enhance the patient experience to improve value. For more podcasts and resources to help you promote value in your community, please visit the Value Initiative's website at www.aha.org/thevalueinitiative. That is all for today, and thank you to everyone for listening.